If you've never done it before, I would suggest start easy, start slow. Choose your lowest SEC cows to treat with a sealer only. That way you can also focus on them more thoroughly and you can dedicate more time to that smaller groups of cows. If you can, dry them separately than to your antibiotic cows, so you won't have like cows with different treatments in the same row in the parlor. And that way you can also dedicate extra attention to the cows that are getting treated with sealer.
I'm joined this week by Pablo Silva Boloña, Teagasc Research Officer, whose work focuses on milk quality, dairy cow mastitis, and selective dry cow therapy. Pablo joins us to explain selective dry cow therapy and why it's been implemented on Irish dairy farms. Pablo also explains the important management steps to ensure successful implementation at farm level.
Selective dry cow therapy means that we treat only cows that need antibiotic with an antibiotic at dry off. So traditionally in dairy farms, farmers would have treated all cows at the end of their lactation with an intramammary antibiotic, and this was used to prevent new infections in the dry period, but also to cure existing infections. Now, what we're focusing on is to try to identify which cows are actually infected and need antibiotic treatment, and the remaining cows that are uninfected get treated with an internal teat sealant alone, which acts as a physical barrier to prevent the entrance of bacteria into the teat, basically.
And I suppose, why has that come about, Pablo?
Yeah, so in 2022, regulation from the European Union on veterinary medicinal products came into effect in Ireland, and this regulation stated that antibiotics should not be used as a preventive measure or to compensate for poor management. So now what we're really trying to do is to get cows that are infected actually receiving antibiotic at dry off, while the remaining cows don't receive this antibiotic at the end of their lactation to avoid the preventive use. And it's also become quite relevant because of the risk of antimicrobial resistance. So there's an overall push on reducing the use of antibiotics in animal production systems in general to reduce the risk of antimicrobial resistance in humans as well.
There's obviously the policy drivers which you mentioned there, but is there benefits, we'll say, to farmers who adopt selective dry cow therapy at commercial farm level?
Yeah, there's a bit of the policy driving this, but it's fair to say that in many countries, so for example, in the Nordic countries, they never actually use antibiotics at dry off. It's kind of normal practice. It's very related to each specific country and region as well. So in some countries, it was never traditional to use antibiotics even then. But one of the clear benefits of adopting selective dry cow therapy is that the amount of antibiotics that farmers could be saving, it's significant. So some farmers will have 60, 70% of the cows without any infections that dry off, and they could eventually build up to reducing their antibiotic use by that much, which is a very substantial amount, both in terms of, reducing the risk of antimicrobial resistance, but also reducing costs of antibiotics. Also, it's very beneficial in the sense that you're reducing the number of intramammary treatments that you're giving to cows at the end of the lactation, which is both, it's a laborsome process and also it is not without risk. And the unintentional benefit, I think, on my side, or what I see sometimes, is that farmers, when they're implementing selective dry cow therapy, they tend to focus more on mastitis management, on, management, general management that would improve udder health of the cows, and that's an added benefit, I think.
And I suppose from your work, what are the main challenges farmers face when implementing selective dry cow therapy?
Mainly from my experience by chatting to farmers and all that, I think they're mainly concerned about making the right choice on which cows actually should get the antibiotics and which shouldn't. And that's one of the things that they focus a lot of their attention. And I think that the challenges might be sometimes lack of help or advice to farmers on deciding which cows should or should not get antibiotic. Also, maybe a lack of advice on what other farm management practices or other things they should be implementing in their farms to, ensure that the outcome of selective dry cow therapy is optimal, that doesn't negatively affect their cows. Um, I think the challenge as well, even if they don't realize it, is to try to reduce the level of new infections that happen from one lactation to the next. And this is what my research has shown is a big factor in this process. So, for example, cows, deciding which cows get antibiotics is one piece of the puzzle, but then at dry off, if cows are not dried very cleanly, they can get infections if they're not housed in the appropriate housing with enough space and enough cleanliness levels. They can get infected shortly after dry off. And if they calve down in a very packed calving pen, for example, or a very dirty calving pen, they can also get infected. So there's a whole lot of stuff that happens after you've made the decision on which cows get or don't get the antibiotic.
And maybe from a practical perspective, how do farmers go about deciding what cows are suitable for selective dry cow therapy? Lots of our listeners will be obviously implementing selective dry cow therapy already and may have thresholds set for their own herds. But is there industry thresholds there and specifics that farmers should ensure that they're meeting?
Um, Yeah, farmers mostly decide by looking at their milk recording SEC records. And there isn't really a mandatory threshold, but we're often recommending that farmers go for a threshold, and it's what most farmers are doing is going for a threshold of 100,000 cells in the lactation. Not only an average, but focusing on individual tests could be important. So and particularly the closest test to drying off would be a key one to ensure that cows are low SEC. But I guess it depends a lot of the infection dynamics. So for example, if a cow's been jumping up and down, let's say to over 200, then back to under 100, then over 200 again, then that may be a risky case, and I wouldn't advise to treat that cow with sealer only. But um, the general standard for the industry is about 100,000, although in other countries they've done it with under 200,000 cells per mil as a cut point. And farmers also, use information about how many cows have been or which cows have been treated. So, for example, the cow has a low SEC, but she was treated for clinical mastitis. Maybe the farmer decides that it's best to use antibiotics. Um, the overall mastitis situation in the farm is important. So farmers with a high bulk tank STC or high levels of clinical mastitis cases in the lactation or a high level of persistently high STC cows in the herd could be more at risk. So they might want to choose a lower threshold to be sure, but also they will need to implement other management practices to manage the mastitis situation, the underlying mastitis situation that's happening. And then there are some farmers that can use other factors as well that they consider the age of the cow, and if the cows have, hyper or rough teeth ends or warts in the teeth, and then they decide as well by knowing there's the specific situation of their cows.
I want to maybe bring you back to, and you mentioned a number of things there farmers should decide on. One of the big ones, obviously, is your milk recording records. Um, how many milk recordings are you saying in the year, Pablo, that you'd need to be making these decisions? And then maybe the second part of that question is you mentioned the last milk recording obviously being critical in terms of a measurement of infection level close to dry off. How close would you like to see that last recording to the actual dry off period?
That's a very good question. And well, regarding the last recording is one of the most important ones. So one very close to drying off, but within 30 days, but the closest you can get to drying off, the better. But within 30 days is what I would recommend of drying off the cows. It's best to have the most up-to-date information. And farmers there's many farmers that are successfully using, milk recording from 20, 30 days from dry off to make the decisions, and the cows get on well in the following lactation. So that's very important. And how many recordings in the lactation? For everything related to mastitis, in my view, the more the better. But
Mm.
I'd say if they can do four at least, that'd be great. It gives you an idea if the cow's been kind of bouncing up and down in their SEC, or if they're not of the if they're actually recovered from the infection or the mastitis or not. So at least four, but for me, the more you do, the better, and the more information you're gonna get, and the more uh, informed decision making you're gonna get out of it as well.
You mentioned then kind of maintaining hygiene during dry off. Have you kind of a set SOP or have you any advice for farmers with regard that actual drying off procedure on the do's and the don'ts around that?
So we actually did a study last year where we looked at kind of like a very high thorough cleaning process of teeth before drying off compared to normal farm practice. And we found that particularly in cows that were treated with sealer only, um, if they were dried off using a very thorough dry off cleaning teeth cleaning protocol, they had a lower SEC in the following lactation. And what I mean by thorough, the steps involved in that protocol were, first of all, before drying off and outside of the parlor to clip the tail hair and the other hair from the cows. And when they went into the parlor, we dipped disinfectant solution, like the teeth spray, for example, that you use at milking time. We waited for 30 seconds, then wiped it off with a paper towel. Then we went in with methylated spirits soaked cotton wool soaked in methylated spirits to really disinfect the teeth. And as a final step of disinfection, then we went in with those alcohol wipes that come in with the sealer um, tubes. And we did a final step of disinfection then. And then for infusing the products, what we did was we used a partial insertion method, which is basically not to put in the entire nozzle of the tube into the teeth, but only kind of halfway through, because it has been suggested by other research that it can cause damage to the teeth end and therefore lead to more infections. And at the end of the process, at the end of the protocol, we applied disinfectant, fully covered the teeth with, milking type teeth disinfectant. So it was a very thorough protocol, and it did require much more labor and much more time than the other protocol. But by doing this, we ensured that cows that received sealer um, had low SEC in the following lactation.
It's a very important point, and I suppose it is, as you say, it does require more labor, but for the periods and the batches of cows are drying off, I'm sure that's something that you would now be recommending off the back of that research, Pablo.
Absolutely. And I would be 100% adamant that if you want to do selective, you have to also be very clean. And the good thing I think about this research is that we've outlined which steps are necessary to get to this level of cleanliness, which is very important because, do this cleanly or hygienically might mean different things to different people. So now we've kind of put in place the steps that are needed, and we have some images as well to show what the level of cleanliness we're trying to achieve as well when we're drying off the cows. But also the future research is going to look at, can we do this protocol a bit shorter? Are there some steps that we could do without and get the same results as we would have, with the full protocol, so to speak?
And you've mentioned a number of those kind of critical steps from your research that show success, I suppose, with regards selective dry cow therapy, that in terms of the selection of the animals, good dry off and cleanliness around actual dry off procedure. Was there anything else from the research? I mean, you've a lot of this research done out on commercial farms. Was there any other factors, we'll say, that were relating to um, how successful it was at individual farm level?
One thing I think is the overall mastitis and SEC situation. So if I have a farm with a high number of high SEC cows, or a high bulk tank SCC, then this affects the outcome in two ways. First of all, I have more infected cows that can spread the infection to other cows. So the infectious pressure is bigger, so to speak. But it makes correctly deciding which cows need antibiotic and which don't much more difficult than when a herd has a low SEC or a low level of persistently infected cows. And that's one thing. So reducing your overall number of cows with high SEC is going to bring about positive factors for a successful selective dry cow therapy implementation. We have other things that we've looked at that play a role, which, for example, mastitis management in general. Um, but one in particular was that farmers that were cleaning their dry cow cubicles twice per day were shown to have lower SEC cows compared to farmers cleaning them just once a day. So keeping the facilities clean is a critical step as well. And there are a couple of cow factors that we saw as playing an important role in success of selective dry cow therapy. So, for example, cows that were dried off um, with under 15 kgs of milk per day, according to their last milk recording records, had lower SEC in the following lactation compared to cows that were higher yielder cows approaching dry off. So, trying to implement strategies to reduce milk yield towards the end of lactation is important, and also to not let, and this goes back to the overall mastitis management situation, to not let, to not normalize a high SEC at the end of the year as a good thing, because we know that if a cow has a high SEC towards the end of the year, she also has a risk of having high SEC in the following lactation. So we need to manage those high SEC cases and those mastitis cases as if we would have in the middle of the lactation as well.
I suppose the concern, Pablo, from a farmer's perspective is that the antibiotics are their insurance as such, and but what does the evidence say in terms of the success of this on herds? How well is it working on herds? You've herds now, a lot of herds using very, very little antibiotic use with regards to dry off. How successful has that been? And you've outlined obviously important measures, but that's obviously the concern from a farmer perspective.
Yeah. So first, I'd like to say that, you know, in a non-infected cow, if you don't use an antibiotic, there shouldn't be any negative risk. But the things that happen after that, it's what either increase or decrease your risk. So as you say, there may have been some sort of insurance by using the antibiotic that other things immediately after that that weren't quite right were being covered by the use of antibiotics. But just if we apply a sealer in a very clean manner and in a very thorough manner, if the cows are housed in adequately stocked, dry cow facilities, and if they calve down in a clean environment, there shouldn't be a negative impact of using the sealer. But what we are seeing is that sometimes farmers might have been struggling with some of these aspects in the past, and some can have a negative impact of using the sealer. So that's very important. But what the research has shown is that is not related to which cows the farmer selected to be treated with sealer only, but it's about the new infections that are happening at dry off or after dry off. So that's the key bit that I keep trying to reinforce, that everything after we select the cows to get sealer only is very important. So how we apply the sealer, where we house them, and how they calve down and where they calve down is very important to ensure the success.
Is there research gaps there that remain with regards to selective dry cow therapy and maybe what's on the horizon from a Teagasc perspective in terms of future research?
Well, one of the pieces of research that myself and my students have been looking at lately is, are there any other pieces of information that farmers can use to make decisions? So, for example, there's still a number of farmers that don't milk record. So we're looking at, um, can they use the CMT, for example, the Clinic California Mastitis Test, to to make decisions on which cows get antibiotic or not? Can they use submission of samples for bacteriology for, getting the bacterial species that's infecting the quarter or not? And we've also looked at what sort of thresholds are the optimal ones for deciding which cows get antibiotic and which don't. So that's one of the pieces that we're trying to answer at the moment. This is active research. Other stuff, as I said to you, we've outlined a very kind of labor-intensive protocol for cleaning teats and for preparing the cows for drying off. And we're trying to investigate, is there one or two steps in that overall protocol that are more relevant that will ensure success with when treating cows with sealer only and without that huge investment of time and labor required. And I think that there's a lot about that I'm trying to put a lot of effort on is how to encourage farmers to implement this practice because I do believe that many farmers can do this safely and have great results. But we need to focus, first of all, on, overall mastitis management, trying to optimize that, but also on the positive message that farmers, by doing this, are reducing their antibiotic use massively. So if they do it on 20% of the herds, that's a huge reduction. It's 4 tubes per cow less that you're using that you would have used in the past. So it's a massive positive impact in the overall scheme of things. Um, and finally, we're also trying to see if we can develop some tools for making them, helping farmers make decisions how to dry off and also for evaluating how things went in the following lactation and stuff like that. I think well, there's plenty of things going on for Chagas, I think, research-wise, and we're trying to really to encourage and facilitate and make life of farmers easier for selective dry cow therapy implementation.
For farmers that are maybe interested in trialing selective dry cow therapy, what practical advice would you give them? You've kind of outlined the steps there and the steps farmers are taking, but maybe for farmers that maybe were slow on the uptake or a little bit concerned, what tweaks would you make maybe to those protocols?
So if you've never done it before, I would suggest start easy, start slow and choose your lowest SEC cows to treat with the sealer only. That way you can also focus on them more thoroughly and you can dedicate more time to that smaller groups of cows. If you can, dry them separately than to your antibiotic cows, so you won't have like cows with different treatments in the same row in the parlor. And that way you can also dedicate extra attention to the cows that are getting treated with sealer. That will get you more confident in doing this and doing this technique and then having good results in the following lactation. Again, going back to the stuff that I mentioned earlier, putting extra focus and dedicating more time to properly clean the teeth and infuse the products when you're treating them with internal teeth sealant alone, I think it's time well invested because it's going to pay off in the following lactation. And try to cull some of your persistently high SEC cows from the herd because they are an infection source. And the first ones that they're going to get to is the cows that were not treated with antibiotics. So try to be a bit more strict in the culling criteria, for example. And in general, try to manage mastitis early in the lactation so that whether that's clinical mastitis or high SEC cows, take action as soon as you see something strange, either treating them with antibiotics. If they don't get better after a few times of being treated, consider drying the quarter and applying other management practices that will contribute to reduce the spread of infection in the herd. So some things are, making sure that you're applying post-milking teeth disinfection, that it covers properly the teeth and the teeth ends. You can do cluster disinfection after high SEC cows to prevent that spreading to other cows. And overall mastitis management really is one thing that I would advise to really focus on.
Look, I want to thank you for your time, Pablo. I think you've covered off a lot of the do's and the don'ts, and very clearly shown that when implemented correctly, selective dry cow therapy can be very, very successful on farms. So thanks for your time,
Absolutely.
Pablo.
No worries. Anytime.
That's it for this week's episode of the Dairy Edge podcast. My thanks to Pablo Silva Boloña for joining us on this week's show. Don't forget to rate, review, and subscribe to the podcast. You can listen on Apple, Spotify, or wherever you get your podcasts. And for more information, go to the Teagasc website at teagasc.ie. I'm James Dunne, and join us next time for your Dairy Edge.